Let me now go to continue our discussion about hospitals. Let's go to Dr. Andy Thomas. Dr. Thomas, you have been with us before. We appreciate that very much. You are on the zone calls, I know, 6:30 a.m. every morning, 7 days a week. Tell us where we are now with our hospital crisis.
Thank you, Governor, for having me back representing my colleagues and the zone leads, but also the doctors, nurses, respiratory therapists, all healthcare providers around the state. First, we say, I'm so sorry for your loss that you started the press conference with. I know many of us have friends and family that we've lost as a part of this, and it never gets any easier. So I'm really sorry for your loss. As we discussed on Monday, we crossed 5,000 COVID patients in Ohio's hospitals on Monday. Today, we're still over that mark at 5,141. As you described earlier, over 1,200 of those patients are actually in intensive care units around the state. As I talk to hospital leaders, doctors, nurses around the state, that's really one of our biggest concerns right now. Many hospitals around the state have been able to increase their capacity for a routine, what's called a med-surg bed. That's kind of a routine bed where you might get IV fluids, you might be on some supplemental oxygen, but many hospitals are able to increase those numbers to a degree. But the hardest area for hospitals to increase their capacity or increase their number of beds is in the intensive care unit. You need very specialized staff, specially trained nurses and doctors, not just any nurse or doctor, but very specially trained respiratory therapists, staff to a level where they can help manage the patient's oxygen. I think we've discussed on these press conferences before the concept of proning a patient, where you actually lay a patient on their chest when they're on the ventilator, and you have to turn them back and over multiple times per day to optimize their lung function. That takes 4 people at a time in the room to turn the patient over and back. In those intensive care units, 1 out of every 3 patients right now has COVID. If that number continues to grow, that is going to crowd out the ability of non-COVID patients to be able to get the care they need in an intensive care unit. Hospitals do not have the capacity in an unending way to grow the number of ICU beds that they have. And what I hear on our daily calls is really that as our biggest concern, that at some point, regional hospitals, community hospitals hit their cap on ICU beds, then they need to transfer to other locations. And at some point, those ICU beds at the other hospitals will be full. So with 1 out of 3 patients across Ohio in an ICU having COVID, in our rural hospitals, it's actually 50 to 60%. So more than 1 out of every 2 patients in the 2 rural regions of our zone that are in the ICU have COVID. That's not sustainable for those hospitals to be able to manage. At this point, hospitals around the state are making the difficult decision to postpone non-emergent surgeries and procedures. So think that neighbor who's scheduled to get a knee replacement or a hip replacement, or that friend from high school who needs back surgery for arthritis in their back. That's a major issue when those people, it's not an elective cosmetic surgery, but it's also not an emergency like an open heart surgery or surgery for a broken hip from a trauma, right? These are surgeries that can be delayed for a period of time, but it's still causing pain and suffering for those patients. It's causing delays in care, diagnostic tests that would potentially diagnose cancer might be delayed, other things. So it's really having an impact now as we see COVID patient numbers grow, that hospitals are making these difficult decisions to delay care. No one wants to see that. The big problem too, that we still have not yet to see the impact of Thanksgiving on our inpatient admission numbers. Thanksgiving was a week ago today, right? We are seeing people over the next 7 to 14 days that will be being diagnosed with COVID because they went outside their bubble to a social event. Then usually it's about a week after symptoms start or a week after they're diagnosed when they need to be admitted to the hospital, and sometimes a week after that before they end up in the ICU. This is not the beginning of the end. This is not even the end of the beginning. We are in a really difficult spot here when hospitals are already at their highest COVID levels and at high capacity across the state. And we're just heading into what the CDC director has described as the most challenging 3 months of this pandemic. So I do know that the surveys are showing that more people are wearing masks. That's great. We need that. We need people to be committed to what they're doing at work or what they're doing at school in their personal life. That's the exact message we need people to understand, so that whether it's your neighbors or friends that might work in a hospital, or someone you care for or love who needs to be in the hospital, you don't want to see them negatively impacted by the number of COVID patients crowding out other patients who really need care moving forward. So that's what we're seeing. But really, ICU beds are the area of capacity where we have the biggest strain right now across the state.
So in your two most rural, I guess that'd be 7 and 8.
Correct.
Southern Ohio, Southeast Ohio, they're over 50% ICU COVID patients, which is
correct. Of all their
phenomenal.
patients in the ICU, 50 to 60%, and it differs by hospital, obviously. Some of our hospitals in Region 7 and 8 are actually running at 120% of their normal ICU capacity. So they've expanded a little bit, but one of those hospitals over the holiday weekend, needed extra ventilators. They were running low on ventilators, and Ohio Health, Mount Carmel, and Ohio State all chipped in a couple of ventilators to send to them. So they're doing the best they can all around the state. Large hospitals, small hospitals, everybody's pulling in the same direction, trying to take care of this surge in patients, but it's just not sustainable.
And one last question. You've talked about this before. You touched on it again here, but so that people, all of us, myself included, understand, and every patient we know is different, but on an average, someone who shows up, on a case today, let's assume that they go to the hospital, and then let's assume that they end up in ICU. So what is the kind of average length of time until we see that? I mean, you're talking about Thanksgiving, so.
Correct. So the timeline of when you're exposed, it's generally not less than 3 days before you would start having symptoms, but it's anywhere from 3 to 10 days where most people would develop symptoms. From that point, and so when you think about it, if you were exposed to someone on, say, Thursday or Friday last week, you're right now in that window where you might develop symptoms, where you may become positive, and then you're going to get tested, and you're going to find out you're positive. It's usually from the onset of symptoms to the time of needing to be admitted to the hospital. And most people being admitted to the hospital have the COVID pneumonia that we talk about. So they need oxygen for their lungs because they have pneumonia. That's usually about 7, sometimes 10, maybe even 14 days after the time they develop symptoms. And then once they're admitted to the hospital, most people, especially if they come in a timely manner, are not put on the ventilator in the emergency department, right? They're started on 2 liters of oxygen, but then by 2 or 3 days later, they're on 6 liters of oxygen. Then they're on high flow heated nasal cannula oxygen. Then they're on a mask that's tight on their face so that we can try to help them breathe, because the last thing we want to do is have to put them on the breathing machine. We found with these other oxygen delivery methods that we can reduce the need for people to need to be on the breathing machine. But from that period of time when you're admitted, it's about a week later on average where a patient would then need to be on the ventilator. And then that patient could be on the ventilator for another week to 2 weeks before, unfortunately, they may get so sick that they may pass away. So that we are just seeing the beginnings of people being tested today or tomorrow or Saturday, seeing the beginnings of the impact of Thanksgiving now. This surge that we're seeing is not about Thanksgiving.
Right. Okay. That's helpful. Thank you. We'll be back to you if you can hang on.
Yes, I will.
Appreciate it very much.